type 1 diabetes is an autoimmune, complex, and lifelong condition. It can develop at any age, regardless of family history. Most people with type 1 diabetes are diagnosed when symptoms appear and the risk of life-threatening complications are much higher. But it does not have to be this way. Through screening for autoantibodies, type 1 diabetes can be detected months, even years, before visible symptoms appear. Early detection has several benefits: time to prepare and seek support, timely initiation of medical treatment, avoiding a misdiagnosis, reduced risk of diabetic ketoacidosis, a potentially life-threatening complication, opportunity to take part in clinical trials. Whilst everyone may benefit from screening, those who have an increased chance of developing type 1 diabetes, like biological relatives, or those people living with other autoimmune conditions, could benefit the most. Across the globe, there's been a rise in research programs and screening pilots, all seeking to make early detection for type 1 diabetes a reality for everyone. Let's take a closer look at some of these initiatives. We start in the Nordics, with a DIPP study in Finland screened around 220,000 newborns, as well as 18,000 families and their infants with a genetic predisposition to type 1 diabetes. This study has helped to reduce the frequency of diabetic ketoacidosis at diagnosis. Fast forward to 2015 in Germany, the FEDE study, in collaboration with primary care pediatricians, has improved early detection of type 1 diabetes by screening for autoantibodies in children aged 2 to 10 years old. Other programs, such as DiaUnion's TRIAD study, focused on the links between type 1 diabetes and other autoimmune conditions like celiac disease and autoimmune thyroid disease. Knowledge gained from these initiatives must be leveraged to support governments establish coordinated, large-scale early detection programs to enhance early detection of autoimmune conditions. Italy became the first country to do so. In 2023, they approved a national law introducing nationwide pediatric screening for type 1 diabetes and celiac disease. In the United Kingdom, the type 1 diabetes risk in adults study offers type 1 diabetes screening for adults regardless of family history. Adults with multiple risk markers are offered additional information about the condition. The United States of America launched the Screen for Type 1 Diabetes Act, focusing on education and awareness. Next to this, multiple states enacted laws that underline the value of early detection and screening. And not to forget, in the European Union, Identify launched in 2023, bringing together 28 partners in 13 countries from academia, life sciences, and health industry and patient organizations to optimize and extend screening programs across Europe. Collaboration is the key to successful screening initiatives. Spain is a good example, having formed an alliance led by 9 scientific societies and advocacy groups of people living with type 1 diabetes to develop an integrated process for early detection. These initiatives are the result of many organizations leading the way on early detection. We must continue to work together to realize global implementation of screening programs and ultimately transform the future of type 1 diabetes detection and management.